We're going to go through wear and care for the Tally 3D printed helmet. And you're going to have a couple of resources available to you. This video is on our website, so you can re-access it anytime you want. You're going to get your paper handout provided from our office. And then the Tally helmets also come with their own little booklet. And all of this information is on an app that you can download for free. It's just the Tally app, but a really nice resource to have right on your phone so you can access any of that information. The first thing we like to go over is putting the helmet on. So this is going to be a bivalve closure. So you're going to pop both sides and it's going to come apart into two pieces here. So there is little tabs on the posterior piece or the back piece, and then there's spots that it's going to align to on the front piece. You're going to simply align those two pieces, put our little rubber band kind of latching band here, and just snap it down. Now what I recommend families do is actually put that on, and then you snap the one side, get the other side lined up, and then you're going to make sure, kind of come back to the front, make sure that it's centered above that nose, that the face box is centered in there before latching that second side. Something to keep in mind, and you can see like that one popped off, that's no big deal, just put it back on. Something to keep in mind is hair. So if your baby does have longer hair, making sure that that hair is not stuck in that seam so it doesn't maybe tug or pull at them just a little bit. But that's going to be putting it on. Now you can do that sitting up. If you have two people especially, you can have someone kind of holding the back piece on the baby and then bringing the front. You'll get better at this as you do it, and you'll be able to do it independently. But in the beginning, if you do have two people, that can be really helpful. The other way that you can put the helmet on is actually placing the helmet down on the ground, and then having baby, get this open here, having baby lay back down into the helmet, and then taking the front piece and putting it down. Just kind of depending on your baby's temperament and how much they're moving. Either could be appropriate options. Again, just latching those. Now these are quite durable, these little rubber bands here, but we have had one break. So they can break. We have extras here at the office, and we typically will send you home with one kind of in your little bag of goodies as well. So we get the helmet on, and then what we're going to do is we're going to come back to the front, and we're going to make sure that the helmet is fitting appropriately. What appropriately means is keeping that above the brows, sometimes even just on the brow line. So we want that helmet around the brow. We want to make sure that it's coming on the side of the eyes so we're not interrupting vision at all. And then we want it to be around the ears. Now, something to keep in mind is that ear placement is typically going to be placed symmetrically on the helmet, even if your baby's ears are not aligned symmetrically. So what that means is they may not fit right inside those ears centered, but we do want to make sure that there's either no touching or just slight touching on either the back or the front. A little bit of touching is going to be okay. As long as it's not rubbing or causing any skin breakdown, it's really fine. But I know that can be something that irritates parents, so we do try to do our best to keep that from touching the ears. Things we're going to do here in the office is we have different pads that we can add. So we've got these little foam pads that come with the helmet. We've also got a softer, it's called rest-on pad, that we can add. And what those pads are all doing is just stabilizing the helmet on the head. Movement is typically what's going to cause issues when the helmet is moving and rubbing. So we want to try to eliminate that movement as best as we can. And that's typically going to be through adding some pads. Almost always we are going to add pads to these cheek struts. Baby's face is going to grow throughout treatment, so we do start with a little bit of room there. So typically in the beginning here, we're going to add some pads. Now this padding on the inside, it is going to pack out or thin out as your baby wears it. So it's going to fit tighter today when we're fitting it than it is in a week. So just kind of know that we're going to fit it quite snug here today, because in a week it's going to loosen up just a smidge. So we kind of went through putting the helmet on here. So getting those latches lined up. Next thing I'm going to talk about is break-in schedule. Now you're going to notice a little bit of a discrepancy between the break-in schedule on this handout here and the break-in schedule on inside the Tally. They're both fine break-in schedules. Basically, we just don't want to go to that full-time wear right off the bat, and this is kind of a tried and true break-in schedule. Day one, you're going to wear the helmet for an hour. You're going to take it off for a half hour break, and the tally it's going to say for an hour. What we're saying is we want you to take it off for at least a half an hour. Taking off for an hour during that break time is perfectly appropriate. But you want to wear it for an hour, off for a half hour to an hour, and doing that about 2 to 3 times throughout the day. So you're going to get about 2 to 3 hours of wear on day one. And today can count as day one, even if you're just getting a few hours in the evening. Day two, you're going to wear it for 2 hours consecutively, off for a half hour to an hour. Oftentimes that break's going to correlate with nap time. So it's going to be on for a chunk of time, off for nap time, on for a chunk of time, off for nap at night. Days 1 and 2, we're not wearing it for any sleeping hours, not naps or nighttime. Once we get to day 3, we start wearing it for naps. And then day 4, you're going to wear it for naps, nights if things are going well. Day 5, we want to be to that full-time wear schedule of 22 to 23 hours a day. So day 3, we're going 2 to 4 hours. So your total wear time is going to be about 4 to 6 hours. Again, 30-minute to an hour breaks, and then wearing it again. Day 4 and day 5. If we are not to that 23 hours by day 5, take some notes about why. Is it something that we need to do from a modification standpoint, adding padding, things like that? Please feel free to reach out and email us. You're just going to send either to Cassie or Callie at babybearcranialclinic.com and send a picture. We're almost always going to ask you to send a picture if there is some sort of fitting issue. Oftentimes we can give you some suggestions on how to help kind of alleviate those issues at home. Sometimes we may have you come back in right away. Sometimes we may just wait until that scheduled 1-week follow-up. So, yes, please feel free to reach out to us. So, one thing that we do like to point out again is helmet treatment is a commitment. Please try to get that mindset of this is a short amount of time. The treatment is a relatively short amount of time for that lifetime of results. So we really get the best results when we have full compliance. That means 22 to 23 hours a day. And we get the best results, getting the helmet on as soon as possible. So please keep that in mind. The issue we have when you're not able to wear it full time is that the baby is growing outside of the shape of the helmet. We can only modify this so much, before we just have to replace it if they've grown out of the shape of the helmet. So we really need to comply to that full-time compliance. Some other things that we talk about, so cleaning. Our kind of go-to cleaning is using alcohol, and you can dilute it. You can do either like a 50 or 90% alcohol, add a little bit of water with that to dilute it some. Some babies can tolerate that direct alcohol, some don't, so we just kind of say dilute it all. We do give you this little spray bottle. You can fill that about half or 3/4 with alcohol and then add a little bit of water. You're just going to take this, spray it directly in the helmet, wipe it out, let it dry. That alcohol is going to disinfect everything, and it's going to help it to dry real quickly. You can do that every time you take the helmet off, but for sure once a day. A deep clean is using whatever baby shampoo you already use. So when we see skin issues, it's typically related to dyes, scents, things like that. So we want to use a shampoo that we already know your baby is not having a reaction to. We do have a couple of recommendations, and you can reach out to us if you are having skin issues, but just use whatever you're already using. Johnson & Johnson and Aveeno are kind of two of the ones, and if you can get a scent free in those options, just scrub it. Now, you can see even in this one, there's the foam's coming up just a little bit. These are all just, the pads are all taped in there with a two-sided tape. So if you do see that, you can always just kind of push it down, and just keep that in mind when you're washing too, not to just submerge the helmet, because that will, it won't damage the helmet, but it will damage that adhesive between the foam and the helmet. So you're going to want to just get a washcloth or a scrub brush or something. You can get everything fully wet. Just don't like soak anything, or it can, like I said, the glue can start coming undone. And if you do ever see that, you just push down to kind of hold that in place. So give it a good scrub, give it a good rinse, and then you're going to let it air dry. It's going to take about a half an hour to dry. Sometimes it might take a little bit longer, but give it a good half hour. Time that out with one of your breaks so that the helmet's off during that break time and drying. Even a properly cleaned helmet can have a little bit of odor or color. Now these 3D printed helmets, really that's one of the things we're seeing a huge improvement on, is they really don't stink. They might have a teeny tiny odor, but compared to some of our other style helmets, that's really a benefit of this helmet. Babies aren't sweating as much, and the helmets are not getting as stinky. You should never see any buildup inside the helmet, like any yellowing or buildup where you could actually like scratch your finger and wipe it off. Skincare. So we always want to prevent skin breakdown. And this skin breakdown is raw, sore, blistered, or irritated skin. Redness, red skin is okay. Where you're probably 90% you're going to see redness on the cheeks. This is holding the helmet from moving around and getting that rubbing. So you're going to see contact points here. And then you're also going to see contact points in that longer diagonal, or if we're dealing with that wide flat brachiocephalic head, you're probably going to see redness kind of above the ear area. So redness is okay as long as it is not breaking down the skin, causing irritation, causing blistering, anything like that. Now, we don't see that too often. More often we see the redness, we'll get a picture and we kind of tell mom it's fine. Now, if you do see redness, one of the first, or if you're like, this redness just seems like it's lasting a little too long, redness can last about a half an hour to an hour after you take the helmet off. As long as it's getting less red or pink, it's not getting like worse or shiny type skin, you're probably fine. But one thing you can use is we do give you these little Aquaphor packets. It can act as a barrier between the skin and the helmet, and it also helps to protect and heal the skin. So this is kind of a number one go-to if you're noticing that little bit of redness. A little bit goes a long way. You don't need a ton, just put a little bit on that area. If you are having bigger skin issues, again, please feel free to reach out and email if you're seeing rashiness or anything like that. We do have some additional handouts we can give you, but we kind of hold off on that so as not to scare you. Sweating is an issue. Like I said, with these 3D printed helmets, it does seem like it is less of an issue, but you do still want to be aware that, there's something on their head that's kind of insulating it, and we want to dress baby a little bit lighter. When you take the helmet off, another kind of good habit to get into is giving them like a head scratch. So if you imagine like when you take off a winter hat and your head's kind of just a little bit itchy just from having contact on there, just give them a little bit of scratch, because babies have those like little razor sharp fingernails, and we want to beat them to it and not have them scratching their face and ears. A lot of times parents will say that they're grabbing at their ears. One of the things in that of like why it's their ears is that's kind of as far as their arms can reach often. So that's sort of where they like behind the ears, they'll often kind of reach and scratch. Another thing, if you do feel like your baby, the redness, you're just concerned about it, you're not, you just don't feel totally comfortable, we recommend diaper breaks. So you can kind of break up that hour to 2 hours of break time however you want. And some families will do just like a 2 to 3 minute break, maybe 5 minutes after every diaper break. And the only reason we say after every diaper break is just to kind of get in the habit of like, okay, I'm going to change their diaper at least, 4 or 5 times during the day. I'll give them that 5 minute break 4 or 5 times throughout the day, just to give their skin a little break, give them a little bit of air and all that. So that being said, we want that full compliance. And we also want you to take the helmet off at least 2 times a day. So first thing in the morning, because they're going to have worn it all throughout the night, take the helmet off, get your eyes on their skin at least 2 times a day. So in the morning, let everything air out, and then you can go ahead and put it right back on, even if it's just a few minutes, but do give them just a few minute break right away in the morning, and then at least one other time throughout the day. We don't want a sore spot to miss getting caught because you're wearing it. You're like, we're wearing it 24 hours a day, and they go, 48 hours without ever looking at their skin. We do want to make sure we give them some breaks. Another thing is to have fun. So babies can read our emotions. Every time you're putting the helmet on, you're like, oh, you poor thing, I'm so sorry. Like they do feel that. So please try to keep it as positive and kind of upbeat as you can. Getting the helmet on, get them distracted. Yay. Okay. Have a toy. Because sometimes it's just the sensory of like putting it on the on and off that they don't like. But once it's on, most babies don't even notice it's there. Again, our goals, so we have 2 goals that we're trying to reach from a measurement standpoint. So we're looking at our diagonal asymmetry, which we want to be at least a 50% improvement from where we started, or 5 millimeters or less. And then we also are looking to get that cephalic index between 80 and 90%. And we'll go through those measurements at every follow-up so you kind of know where baby's falling as we go along. And then the other goal being visual improvement, and just kind of that aesthetic appearance as well. We strive for 5. Just at the bottom of our handout here, we always ask that you give us a review, whether it be now or throughout treatment, Families really rely on, feedback and comments from people like you. And so that can be really helpful just so they can get understanding. This can be a really scary process, kind of stressful. And at the end, almost always we hear, oh, that wasn't as bad as I thought. It was pretty easy. My baby didn't even mind it. So please feel free. And we ask you please to share those thoughts. Google reviews are great. So thank you so much. And again, questions or concerns, you're going to email Cassie at babybearcranialclinic.com or Callie at babybearcranialclinic.com.